As heart failure worsens, it becomes more challenging to manage a patient's fluid balance. Diuretics, which are dependent on adequate cardiac output and renal perfusion to drive urine output, may become less effective and less predictable. With heart failure, reduced blood flow activates compensatory mechanisms that drive salt and water retention by the kidneys, reducing urine output and increasing intravascular volume. Higher venous pressure follows, leading to movement of fluid into the extravascular space, presenting as swelling in the extremities, ascites, and/or shortness of breath. Diuretics alleviate these symptoms by increasing urine output, which reduces intravascular volume and venous pressure, pulling fluid back into the intravascular space, reducing edema and other signs and symptoms of heart failure. This fluid return, or plasma refilling rate, helps to prevent intravascular depletion. However, the effects of diuretics are unpredictable. If the urine rate exceeds the plasma refilling rate, intravascular depletion results, dropping cardiac output and renal perfusion, leading to reduced urine output. Increasing the dose only increases intravascular depletion, further limiting urine production. Acute kidney injury may follow. Reprieve Cardiovascular's guided diuretic therapy may protect from these dangerous drops in intravascular volume by allowing the clinician to set a fluid loss limit, the highest rate of fluid loss the clinician feels is appropriate, for example, minus 100 milliliters per hour. After the clinician administers furosemide, the device measures urine output and automatically infuses saline to prevent exceeding this limit. By limiting fluid loss, particularly in the face of high urine output, the system should maintain intravascular fluid volume and with it, cardiac output and renal perfusion. Initial clinical experience suggests the therapy may also increase urine output, in some cases by over 200%. As guided diuretic therapy drives higher urine output, the fluid loss limit may be increased, allowing for even higher net fluid removal while maintaining intravascular volume. In the future, sensor technology integrated into the system may allow the fluid loss limit to be maximized while protecting from excessive fluid depletion. Reprieve Cardiovascular's focus on fluid management has the potential to establish a new frontline standard for care for congestive heart failure. Reprieve Cardiovascular. Experience life without limits.